Kidney disease is common. It affects about 10% of the adult population. Majority of these patients are actually cared for in the primary care setting. But what we've done is actually look to try and identify patients at earlier stages of their kidney disease. And some of the research that I did is actually based on data that we've assembled throughout the province of Alberta, where we've linked administrative, health-related information with laboratory data. And what we're able to show is that a simple urine test, the amount of protein that's present in the urine, is actually one of the most important predictors of progression of kidney disease. And so the research and the basis for my research is really two components. One is the assembly of this large cohort or information on patients across the province, and then our finding that a simple urine test can be used to predict progression and outcomes in this patient population. It's the patients. It really is what grounds us in what we do. It's in seeing the patients and just wanting to improve the care and outcomes for that patient population. And in fact, what we're doing now is much more patient-centered in terms of our research. Our research activities are incorporating patients in all aspects of our research now. We've done activities, what's called patient research priority settings, where we actually go to the patients and say, what are the research questions that are important to you? And what we found actually is that the questions that are important to the patients are very different than the ones that investigators that we think are important. And so we really are incorporating the patients at all levels of the research, and they really are our partners now in the research. So it's the patients that really are the motivating factor.